is Oluchi Osondu. I am a clinical psychology master's student from the University of Nigeria in Nsukka. I am very happy to be here, learning from these great scholars and experts in mental health. And it is also a privilege for me to stand before you to present my research. The topic is Resilience and Religiosity Buffer the Association between Personality Traits and Mental Health of Widows. Imagine the profound loss that comes with losing a spouse and the journey that follows it. Spousal loss is one of the most stressful adversities, ranked number 1 in the Holmes Rahe scale of 43 different life events. Loss of spouse is among the most negative life events, next only to the loss of a child. And the disorganization and trauma that follows this death of a spouse seems to be greater in women than in men. This is because women tend to build their social identities around their husbands. And when the man dies, they seem to be disorganized and threatened. In Nigeria, where I come from, widows face myriads of economic, social, and psychological problems. Despite the advances in exchange of living exchanges of people worldwide, you notice that widows are still in the condition of deplorable. They are not being considered. They are just left incapacitated. Negative widowhood practices such as denial of rights of widows to inherit their husband's properties, especially if the person is barren, if she has no male child, if she is young, or if she is coming from a less influential families, is still part of the ordeals in the community. And it was also observed that maltreatment from husbands' families and also sexual advances from men, which some of the widows tend to accept due to financial challenges, is also part of the ordeals that widows face. Decades of research have linked personality traits to mental health, but research on widows is still limited. Some personality traits have been found to be risk factors of mental health, and some have also been linked to adverse mental health outcomes, which means that all personality traits do not play the same role on mental health. And it becomes important that research identify those personality traits that are risk factors and those that are protective factors on mental health of widows. There is paucity of research on factors that may either ameliorate or potentiate the personality trait, post-trauma mental health link. Even as some widows in the midst of their condition fall apart, there's some that can be able to cope with their condition and also keep psychologically healthy. So the researchers are interested to know those personality traits, those factors, those things that help widows to keep psychologically healthy. It has also been observed that resilience and religiosity function as a protective factors for mental health of widows. Therefore, the aim of this current research is to establish the relationship between personality traits and mental health, and also to know the association, how this resilience and religiosity can buffer mental health. Personality is the development and pattern of each person's behavior. The personality traits used in the current study are openness to experience, conscientiousness, extraversion, neuroticism, and agreeableness. Resilience is a return to baseline functioning despite exposure to high magnitude stressor. Religious commitment is adherence to practices and belief of an organized church or religious institution. And mental health is the degree of condition of an individual which promotes a state of adequate and balanced functioning in daily living. This diagram is a model of Markin Kindness et al. 2002 schematic presentation on mental health. This diagram or model tends to explain the different factors, how different factors can influence mental health. That is how biological factor, psychological factor, and social factor can interact and influence a person's mental health. Then in this study, cognitive behavioral theory also serves as a framework. In CBT, personality, resilience, and religiosity are seen as factors that can influence how an individual process and respond to stress and mental health challenges. Each of these factors can either protect or contribute to mental health challenges. But CBT have a way of providing a structured way of addressing maladaptive thought patterns and behavior. Based on the aim of the current study, we therefore hypothesize that widows with higher extraversion, agreeableness, and conscientiousness will report better mental health status, whereas those with more neuroticism will report poorer mental health. Widows who are more resilient will report better mental health. Greater religious commitment will be associated with better mental health of widows. Resilience and religious commitment will buffer the association between personality traits and mental health of widows. The participants involved in the study were 300 widows from Obo-Bansuka local government area of Enugu State, Nigeria. They were purposefully selected from 3 randomly chosen autonomous communities out of 5 autonomous communities. The instruments used for data collection were the Big 5 inventory by John, 1990, Resilience Scale by Wagner and Young, 1993, Religious Commitment Scale by Washington et al., 2001, and General Health Questionnaire by Goldberg, 1972. The General Health Questionnaire is a measure of psychological problem. Therefore, high scores on the General Health Questionnaire will indicate poor mental health, while low scores will indicate high mental health. As recommended by Douglas and Clegg, 1983, the instruments were translated into Igbo language using a backward translation method by 2 experts from the Department of Linguistics and other Nigerian languages. The instruments have adequate reliability and validity for the current study. The study adopted a cross-sectional design, and the hierarchical multiple regression analysis was used for data analysis. Results indicated that age, education, and childbearing were added as a control variables because of their significant correlation with mental health. Their effect was controlled for in the regression analysis. However, they appear to have no significant effect on mental health. Personality, resilience, and religiosity. In terms of personality traits, openness, conscientiousness, and the extraversion were not significant predictors of mental health. Agreeableness was a negative predictor of mental health, and neuroticism was a positive predictor of mental health. Resilience was also a negative predictor of mental health, and religiosity was a positive predictor of mental health. Increased extraversion was strongly associated with better mental health status for highly resilient widows compared to those with low resilience. Increased agreeableness was strongly associated with better mental health status for highly resilient widows compared to those with low resilience. Neuroticism was more robustly associated with poor mental health status for highly religious widows compared to less religious widows. The study has several implications, and some of which include that personality matters in people's mental health, but resilience building program and resources are helpful in improving mental health of widows. As widows become more religious, they may become less psychologically healthy. Some of the limitations of the study. The study used cross-sectional design, which does not give room to causal statements or generalization of findings. Self-report measures was used, which may be subjected to likelihood of bias and social desirability. The study also used sample from one ethnic group in Nigeria, meaning that there was lack of diversity, and this cannot allow for generalization of findings. Based on the limitations, the research suggests the use of longitudinal methods of investigation to assess variables over time. Mixed methods of research should be used. This is because quantitative method of research may not give adequate understanding of the psychological health of the widows, and the inclusion of more diverse samples from other ethnic groups in Nigeria should be encouraged. In conclusion, the buffering role of resilience and religiosity in the personality mental health link suggests the potential effective intervention that incorporates these resources to enhance the mental health of widows. Thank you for listening.